My name is Kelsea Branham and I'm doing my speech on non-Hodgkin's lymphoma cancer. According to the American Cancer Society, a person has 1 in 50 chance of developing non-Hodgkin's lymphoma, also known as NHL. NHL is a cancer of the lymphoid tissue where a certain type of blood cell grows abnormally. I have life experience with this topic because my grandpa was diagnosed with this cancer a few years ago. I have found my information from David Duckel, N. Howler, American Cancer Society, and the lymphomainfo.net. Everyone in this audience has experienced what this cancer is and does because they have witnessed it through my grandpa. And they should all know the facts for precautionary reasons. A person should know what NHL is and the facts about it, which include the statistics, signs, and treatments. With this being said, most people do not know what these are. 70,130 men and women will be diagnosed with non-Hodgkin's lymphoma this year. NHL is the most common cancer of the lymphatic system. NHL is more common in men around 65 years old than women. Over the past 30 years, there has been an increase of about 5% in men and 2% in women, imposing a greater risk of obtaining this cancer. Age is also a major factor in the survival rate of this cancer. The older a person is, the less likely it is for them to survive. The average age of death due to NHL is approximately 75 years old. Another risk of this cancer is the longer you have it, the years you have to live after being diagnosed decreases. The survival rate after being diagnosed is 53% after 5 years and 36% after 10 years. Patients who have the cancer longer than others can be a result of the signs being missed. The symptoms of NHL may go unnoticed and can be very detrimental to the body. The cancer can spread throughout the body over a week or several months. The most common sign of having lymphoma cancer is the swelling of the lymph nodes, which can be located in the side of the neck, underarm, groin, or above the collarbone. The appearance of these lymph nodes could be itchy, red, or purple. The signs can be unrecognized because they are often misconstrued as the common cold or flu, which can also cause weight loss, fever, night sweats, shortness of breath, cough, fatigue, or chest pain or pressure. If the cancer is in the body long enough, without any of these signs being recognized, it can spread throughout the body and cause many more problems. Lymphoma can spread to the abdomen, which can cause fluid buildup and the spleen to enlarge. It can also travel to the intestines. This may cause holes to appear and fluid from the intestines to leak out. The leaking fluid can cause serious infections and pain. The earlier recognition of this cancer, the easier it will be to treat. Treatments for non-Hodgkin's lymphoma differ from patient to patient depending on the stage, age, and location. The most common form of treatment for NHL is chemotherapy. This type of treatment uses cell-damaging medicines to target and kill the cancer cells in the body. This therapy attacks cells that are dividing rapidly and also damaging good cells along the way, which causes hair loss and sickness. The second form of treatment is radiation, which uses high doses of X-rays and gamma rays to kill a cancer cell. This can be done on the whole body or certain areas where the cancer is affecting. Along with this, there's a third option of treatment, which involves the injection of an antibody that will bind to antigens to destroy a certain type of cancer cell. In conclusion, non-Hodgkin's lymphoma can happen within a blink of an eye. The signs can go unnoticed and not be painful at all. Lymph nodes can be found in the neck, groin, above the clavicle, and in the underarm. In most cases, people think they have the flu or cold. Spreading of the cancer can cause more pain, infections, and more detrimental damage. NHL is often seen in old men around 65 years old. The longer you are diagnosed with NHL, the less likely you are to survive it. The earlier you recognize the symptoms of itchy, red, and purple lumps, fatigue, fever, night sweats, and chest pain, the easier it will be to treat the cancer. The treatments involve chemotherapy, radiation, and an injection of an antibody. Most people do not know what non-Hodgkin's lymphoma is, or the facts about it, which are the signs, treatments, and statistics. The more people are educated, the easier it will be to recognize the symptoms and get the proper treatment. The more information a person knows, the less chance they'll have of being the 1 out of 50 getting this cancer.